I'm a board-certified family physician, and one of the things my patients ask me over and over again is about the wonderful health benefits of this coconut oil. And I'm left in the situation when they ask me about the health benefits of, smoking 10 packs of Camels a day, which is I can't think of any health benefits for that. Bacon grease, when you cook it, it solidifies after it cools into the sort of thick, whitish yellow, sort of flecked stuff because it's solid at room temperature. And when you buy your coconut oil, it's also solid at room temperature. And fats that are solid at room temperature are called saturated fats. And saturated fats are universally bad for you. Now, the thing that people ask me about that's so great about coconut oil supposedly is this medium-chain triglycerides that make up somewhere around 10% of the coconut oil. Medium-chain triglycerides do have some unique properties for people who have very specific, rare diseases of the gut that don't allow them to absorb enough calories. So, if those people get medium-chain triglycerides, they help that person to gain weight. If that's your problem, usually a doctor will make that recommendation for you, but it's certainly not going to make you lose weight, and there's never been a study looking at people getting medium-chain triglycerides or coconut oil that showed that they facilitated weight loss. Typically what we see is really remarkable elevations of risk factors for disease. So your insulin levels will go up when you eat coconut oil, your triglycerides will go up, and your cholesterol will go up. So studies have actually been done looking at various things in relationship to dietary fat and cholesterol. They did a study that was published in the American Journal of Clinical Nutrition that compared replacing all the fat in a normal Dutch diet with specific fats and seeing what the effect was. And unfortunately, the very worst effect was palm oil, but number 2 behind palm oil was coconut oil, raising cholesterols between 37 and 34% depending on the total or LDL cholesterol. Another study looked at people either eating low sugar or high sugar diets and seeing the effects of safflower oil and olive oil and coconut oil on their cholesterol. Well, the people eating the high sugar diets on coconut oil had by far the worst cholesterols, with averages in the 260s compared to around the 200s for olive oil and around the 170s or 160s for safflower oil. So clearly, by far, coconut oil is the worst. Additional studies have actually shown that palmitic acid, which is one of the main components of coconut oil, has in laboratory, when dripped on pancreatic cells, turned those pancreatic cells to be much more diabetic. It creates this genetic and epigenetic changes that are associated in human beings and laboratory animals with diabetes. So with all this information, clearly coconut oil is a disaster for your health. It makes you more likely to have diabetes, more likely to be suffering from heart disease or stroke, and it helps you gain weight. So if you want any of those things, then maybe coconut oil will be a choice for you, but you don't. You want to be healthy, you want to have a good long life, so avoid coconut oil and products that are made with coconut oil. Thank you for your time.